Thank you, Dr. J. So I am speaking on lens sparing stage 4B ROP surgery with the anti-VEGF. A 3-month-old baby was brought to us at INJ on 19th August for surgical management of ROP, which was diagnosed in Dubai and was advised surgery for the same. So left eye injection Lucentis was given and diagnosed with left ROP stage 3 zone 1 plus, and right eye anterior zone 2 no ROP, and that was in Dubai, and C-section was done, 33 weeks premature, birth weight 1.5 kg, NICU for 28 days, no consanguinity. Dilated fundus was done, and macula, you can see a thickened hyaloid over the optic nerve with peripapillary and macular TRD. Peripheral lesions, temporary peripheral avascular retina with elevated ridge over 6 clock hours, temporarily having florid neovascularization, stage 4B ROP, whereas nasal retina normal. So diagnosis OS stage 4B ROP, status post injection Lucentis. We advised 27 gauge lens sparing vitrectomy. This is the pre-op B scan showing the macular traction retinal detachment, and that's the surgery. So doing the pars placata approach, and I use the 27 plus. So usually you don't do the tangential, you like to do almost vertical so that you don't damage the. So you can see the temporal like apparel membrane with a traction to the periphery. So I do the using the vitreous cutter with the high cutting, cutting the tangential traction. Use the steroids to identify the non seeing vitreous part, trying to stain it and remove the vitreous because there was no PVD, so you have to create it. You have to be careful. So you want to clear as much as of vitreous as possible, and not a base excision, but clear the. And then I use the forceps to lift the membrane. Till that time there was no ooze of blood, but you can see the underlying membrane was there, and there was neovascularization in the peripheral part, and you can see the apparel membrane which was part of that were cleared, and I am using the retinal brush to clear the pre-retinal hemorrhage, and then you can see the most of the hemorrhage is cleared. So I used PFCL at this stage to act as a third hand, so that I can clear the keep the macula in position and complete the peripheral relieving the traction using the cutter, and then whatever ooze happened also was removed. So this is again I use a continuously 3D and wide angle, and under the PFCL again I tried removing the membrane. We can see the membrane was more stronger than the underlying retina. So whatever membranes I could peel, I peeled it off. There was some pre-retinal hemorrhage. So finally I removed the PFCL, and then also removed the pre-retinal hemorrhage, did a fluid air exchange, and there was some ooze happening, and then finally injecting the anti-VEGF, kept the pressure a little on the higher side for some time so that peripheral blood was left as it is. And this was the conclusion where during the surgery the photographs had been taken. So that's the advantage of having where you can have the computer images where you can take pictures of the surgery. So post-op you see the retina attached, and thank you very much.